to the first Public Health Wales International Health Forum. And it is a pleasure to welcome you all today. My name is Liz Green. I am a consultant in public health for policy and international health in the Policy and International Health Directorate and WHO Collaborating Centre for Investment, Health and Wellbeing in Public Health Wales. I'm also the lead consultant for the International Health Coordination Centre, or the IHCC, which has a facilitating and enabling function for international health partnership working and activity across the NHS in Wales. Never has international health and global health been more important, I feel, with conflict, with pandemics, with polycrises happening across the world. What we can learn from each other and share and mobilise action together can only be of critical importance. So today is about sharing some of the work that we do in Wales and setting the scene for you, but also engaging with some of our international partners. And I thank our colleagues from the WHO Europe Venice office for coming today to speak to us all as well. So we've got some great speakers. We have, as everything with events, there's housekeeping. So if you have any questions, then please post them in the chat, and we will try to answer them as best as we can. After all of the presentations, there will be a chance for you to ask questions. So the webinar is being recorded and will also be made available on the Public Health Network Cymru's website after the session. And the IHCC is very grateful for the support of the Public Health Network Cymru today in facilitating and helping us co-deliver this. If you have any experience with difficulties with the technology, then please let us know through the chat and one of the team can contact you directly. I also have a co-partner in crime on the chair today, which is Mariana Diakova, who I've worked with for many years and many of you will have heard of and respected. So Mariana, you'd like to say a few words and then we'll move on to our first speaker. Thank you.
Thanks a lot, Liz. A pleasure to be here, Borda and Croeso. As Liz mentioned, I'm a colleague, a consultant in public health as well, and I'm the head of International Health for Public Health Wales. So really pleased to welcome you all at this first Public Health Wales Public Health Forum, which is building. It's a milestone meeting, but it is building on the legacy of a lot of work which has been done over the years, building on rich international work and experience across the organisation as well as across the whole of Wales, on our international health strategy, as well as on the brilliant work of the IHCC across the NHS, coordinating and supporting and enabling international partnerships. So we aim for this forum to be progressing forward these commitments of the strategy and the IHCC and Wales as a small but forward and outward-looking nation, and having a global impact with its important legislation, as well as with its global health links across the world, not only Europe, but Africa, Americas, and so on. We meant, as Liz mentioned, for this to be a forum for bringing international and global health learning, for sharing, for developing synergies, opening opportunities for people in Wales, most of all maximising the value for our population, our people and communities in Wales, the value for health and public health and well-being, as well as maximising our Wales offer and impact on the global health agenda. So really pleased to be here. Thanks a lot. Huge thanks, Liz, to you and Laura and the whole of the IHCC team, which is very small, and as well as to the Public Health Network Cymru. for facilitating this, and we hope this will be regular, quarterly, isn't it, Liz? And that will bring the experience of colleagues across the organisation, across Welsh Government, other partners, NHS in Wales, as well as we would very much like to bring international speakers as we have today from WHO, as well as from other organisations. Thanks a lot, and I hope you enjoy and it's useful. Thank you.
Thank you very much, Mariana. Diolch yn fawr iawn. So without further ado, I'm very pleased to welcome David Warren. David is Head of International Relations and Trade at Welsh Government. And David is going to speak to us about the international strategy for Wales. So over to you, David, and thank you very much for bringing this work to us.
Good morning, everyone. I'm just going to try and set up my slides. There we go. Is that coming up okay? Is that okay?
I've got the circle of doom. No, it's up. Great. Thank you.
Up.
Thank you, David.
Okay, hopefully you can see that okay. I'll say a few words in Welsh and then I'll carry on. Bore da, diolch yn fawr iawn am y cyfle a bore yma I siarad gyda chi. Mae'n bore rewllyd iawn yma yn Rhagana yn Caerdydd, felly gobeithio bod chi'n cadw yn gynnes lle bynnag dych chi. Really good morning. Thank you so much for the opportunity to come and talk to you this morning. It's a very frosty and cold morning here in Canton, in Cardiff, and I hope that you're keeping warm wherever you are. I know that the weather's quite interesting in the UK at the moment and elsewhere, and maybe we'll talk a little bit about climate change and other issues as we go through this presentation. My name is David Warren. I'm the Head of International Relations here in the Welsh Government, and I'm responsible for helping deliver the Welsh Government's international strategy for ministers, and I'll talk a little bit about that. So I'm afraid I'm not a public health expert, but I'm incredibly interested in a topic area. So I'm hoping over the course of this morning to learn as much from you as you possibly can from me. So what I'll do is I'll do a quick canter through the Welsh Government's international strategy and our work, and really hopefully give you a bit of a flavour of the whole breadth of things that we do, with a bit of a health focus too. The Welsh Government's international strategy was published almost 5 years ago, so the current iteration's come into the end of its life, and really it's about setting out Wales as an outward-looking European nation. I think someone said in the opening remarks about Wales being an outward-looking nation, and I think this strategy really is about emphasising that. If you think it was published 5 years ago, that would have been around the time that the UK was leaving or preparing to leave the European Union, and so I think the Welsh Government ministers were keen to emphasise that although we were leaving the European Union, we were very much an outward-looking nation and keen to maintain links, friendships, partnerships as we go through. The strategy, I'll go through some of the aims in this minute of the strategy, but the strategy is that 5 years old, so we're coming to the point now where we're starting to evaluate its impact. But clearly, it's been an incredibly turbulent time, I think we could say. Global pandemic and conflict has really shaken up a lot of our kind of work around international relations and engagement. And I'm someone who's generally glass half full about things. I think one of the benefits to come out of this really difficult period for Wales has been that there's been a growing awareness of Wales on the international stage, and I think we can evidence that. I think taking specific Wales-based decisions during the pandemic, but also all the way through to Wales's achievements in sport, culture, innovative policy, etc., has really kind of propelled Wales onto the international stage. It's a fantastic moment to be involved in this particular topic area. The strategy's got 3 aims. I think they're kind of obvious. I think if you were expecting from an international strategy to raise the profile of Wales, to grow the economy and to establish Wales as a globally responsible nation, and I'm principally responsible for the first and third aim there, but I will talk about all of them. As a Welsh Government, we have 21 offices in 13 different countries. So normally they're based within the British embassies in those countries, but with the exception of Brussels and London, which have got their own Welsh Government offices. And within the Welsh Government, the international relations team is based within a wider international relations and trade directorate. So hopefully that gives you a little bit of a context setting. In terms of raising Wales's profile, when the strategy was published, you can see there some of the aims. It was around increasing our presence in Europe, working with diaspora and alumni, coordinating activity, working with the UK government, and building existing relations. And I'll talk about some of that in a little bit more detail. But really, it was about showcasing Wales as an outward-looking nation. That point that I made before, looking to sustain partnerships, friendships, connections. And I think because of some of the things that I mentioned before, achievements in innovative policy, sport and culture have really kind of really molded this particular aim, really given us a lot of opportunities to talk on the international stage. And I'll cover a little bit more about this. Clearly, growing the economy is going to be an important part of any international strategy, and you can see some aspects there around exports. Some of the real strengths of the Welsh economy, things like life sciences and cybersecurity, and then also recognition and research. And so trade also has an important link to some of our health connections. And for example, last year we saw a trade mission to the Arab Health event out in the Middle East. The globally responsible Wales, which is probably the area I'm going to focus on most in terms of this presentation, really kind of in terms of the strategy relates to things like promoting understanding and implementation of the Wellbeing of Future Generations Act, sharing experiences, some of those innovative policy areas. So we've got language policy and recycling down here, but it could be on transport, it could be on health, it could be whatever. I think really kind of looking to share our experience and learn from other countries. We also want to cement our reputation as a fair nation, and there've been quite a lot of again, innovative policies from Wales, from embedding children's rights in policy to other kind of key aspects where we've embedded equalities and rights in particular pieces of work. And again, I'll touch a little bit more on that. We're going to touch a bit more on human rights and promoting peace, but things like the Academy Heddwch, the Peace Academy, which has been set up and in Wales as part of the international strategy. And on Saturday, I was at the Academy Heddwch's first annual conference, where again people gathered from around the world actually to come and talk about peace. And there was a strong connection there. There were workshops on peace and health and peace and the environment, again looking at how Wales can contribute to those discussions on the international level. The same with the Wellbeing of Future Generations Act, and I'm sure I'm going to come back to this a couple of times. A really important aspect of Wales, being one of the first nations in the world to embed sustainable development goals into legislation, but also the fact that work is now shaping the international scale. So, for example, we've had over the last couple of years, we've had a delegation engage with Wales from Maharashtra and India, who are now pursuing their own Future Generations Act. In September, we were at the United Nations as they launched their declaration of future generations. Again, the Secretary General being clear as he had before, that what Wales is doing today, the world should be doing tomorrow. So again, the Future Generations Act really, really important for us. What I'm very conscious of is not just talking about the fact that we've got an act and a commissioner, but talking about what it does, and I'll touch a little bit on that as we go through. I mentioned before that relationships, friendships, connections, partnerships are really, really important for Wales. And so the international strategy is very clear that we should build on existing relationships and create new ones. And Wales has agreements with a number of regions and countries around the world, in Europe, from Ireland, Flanders, the Basque Country, Catalonia, Baden-Württemberg, Silesia, to wider regions like Quebec in Canada and Oita in Japan, and others besides. Birmingham in Alabama was an agreement we made last year. These agreements are really, really important because they facilitate a number of collaborations, and often, almost without exception, there is a health element to these. So, for example, our agreements with the Quebec and the Basque Country encourage cooperation and collaboration in health and social care. while Ireland and Brittany kind of focus on research and social policy, particularly on women's health and community services. And we had the delegation over from Birmingham, Alabama a few weeks ago, and their visit was particularly focused on life sciences, for example. So we're using those priority regional relationships to really focus on where we can share learning and collaborate on particular issues. As part of the international strategy, we have a Wales in year, a year where we focus on a particular country every year. Started with Germany, we've had Canada, France. This year is India, where we signed an agreement, a memorandum of understanding with Kerala around the ethical recruitment of 250 nurses, as well as trade missions going to India. We're about to launch the Wales and Japan year next year. And again, that will focus around the World Expo in Osaka. And one of the themes of that World Expo is around saving lives. And again, there'll be a strong link there between some of the health work that we're doing in Wales and that expo. So again, a really, really important connection for us. And we're seeing really important connections emerge from that. So, for example, the work done at Atlantic College around lifeboats and the development of boats and development of safety systems. Again, we're working with Japan on some of that, some of those initiatives too, to share that learning. So as well as the kind of high level kind of trade missions and events, we're also looking at where we can share stories from particular parts of Wales with that area. Hopefully many of you be aware, the Welsh Government also had a focus on international development, and our Wales in Africa programme has been going for a long time. And a number of links and partnerships with sub-Saharan Africa, and you can see that we've had things like the Wales Health Link Networks, which has been linking up health boards in Wales with ones in Africa. During the pandemic period, we were able to reallocate a lot of funds to support programs there, and we have our kind of continuing international learning opportunities program, which sends people from the public services over to learn in Africa about particular work they're doing there, and often that has been focused around health. But I think it's important to say that our international development work has focused on supporting dozens of small civic society groups as well in Wales who work with African partners on things like education, climate change, livelihood, sport and culture, but also health projects promoting well-being. And the Wales for Africa grant scheme gives a number of grants between 1,000 and 25,000 to support to deliver the UN Sustainable Development Goals and through particular projects. And they've supported things like projects to manage injuries caused by conflict-related sexual violence in the Democratic Republic of the Congo, providing products and capacity building around sanitary health in Zimbabwe, training optometrists in Ghana to deal with glaucoma, establishing a pediatric ward in Liberia, and developing wash facilities in Uganda. And in particular, one of the projects that I know the Wales and Africa programme are particularly eager for me to talk about is the programme to train a course for burn nurses in Tanzania. And so but burn injuries are perhaps some of the most challenging injuries to treat. And so there's been a particular focus on a program there, 5-day program to support people there and to develop the unit there. There's also been work around palliative care, a training program developed, again, learning from countries like Bangladesh, Ghana, Nepal and Ethiopia, but sharing that learning across some of our particular partners as well. So the Wales and Africa programme has been really an important programme for us. Okay, I want to talk a little bit more broadly about the Wales, a globally responsible Wales in the time that I have left, because that commitment to kind of fairness and global responsibility really lies at the heart of the international strategy. Wales was one of the first nations to declare itself a nation of sanctuary, and that has, for example, has shaped how we have welcomed those fleeing conflict from Syria, Ukraine, and countries like that, so on and so forth, and a particularly Welsh approach around the support that we provide there. Also, I mentioned before about this nation of peace, and we've set up this peace academy, the Academy Heddwch, which is drawing on other other learning from other peace institutes, which are common in Europe, perhaps less common in the UK. But again, drawing together research on how we promote peace, how we look to kind of reduce conflict, but also looking at some of the challenges around, as I said, things like environment and peace, health and peace, etc. Climate change has also been a really important aspect for us. And last month, we welcomed the circular economy hotspot to Cardiff following a successful bid for that, a major international event which brought people from around the world. And again, health was an important part of that as we looked at issues like pollution and recycling, etc. But there are other ways in which we kind of encourage activity. So, for example, as Wales has qualified for a number of sporting tournaments over the last couple of years across football, hockey, netball, rugby, etc., we've looked to try and develop a particular Welsh approach to sports diplomacy with our partners. So, for example, working with the IRD, that's the Welsh youth movement, to develop a programme called Language Through Play, Chwarae yn Gymraeg, where they've been able to encourage language learning through active play, and those are although it's a Welsh English learning model originally, we've developed that for other languages with the Arabic and French and Breton, etc., to be able to encourage learning through activity. I am probably running out of time, but I will look to wrap up relatively quickly. I want to come back to the Wellbeing of Future Nations Act, which I've spoken a little bit about before. It is that empowering piece of legislation that puts long-term thinking as part of our work. So, and I think that is really, really important for everyone's health and well-being, particularly those generations not alive today. But it's okay to say we've got a Future Generations Act and a commissioner. I think really it's really important to demonstrate for me the implementation of that. And before I worked in international relations, I worked on the circular economy and policy and Wales's approach to recycling the environment. And one of the things I want to say is really how empowering the Act is in terms of doing that work. So, for example, when I was working on waste and recycling and the circular economy, the notion that I could think of all the 7 goals and how that work would contribute to that was incredibly powerful. And so, for example, we started that work by thinking about how could we contribute to a healthier Wales. And so we started to think about how some of the initiatives we're doing, for example, the community initiatives like repair cafes and libraries of things, how they can bring people together and tackle isolation, how we can look to redistribute food and avoid waste, again, to contribute to people's well-being, how some of these initiatives can support the regeneration of town centres, how zero waste vehicles can reduce emission, improve communities, etc. All of these things really, really empowering to help us think about health and well-being as part of whatever we happen to be working on in terms of policy, strategy, delivery, etc. And then the final thing I would say is that also one of the amazing things about the Wellbeing of Future Generations Act is that it brings culture into the conversation as well. And there's been some really great work by one of our partners, Wales Arts International, around arts and health. But for example, last month they held a Cylch Gwrando in Caernarfon, what would it be, a kind of listening circle where people from First Nation communities were brought from around the world to North Wales to have honest discussions really about really around the frame of Indigenous languages, but really around how much some of the treatment of those communities, for example, some of access to health, access to other facilities, education, etc., really have an important impact on their well-being. And those discussions have those deep, difficult discussions are being held here in Wales, again, to help inform that UN Decade of Indigenous Languages. So this kind of work, this kind of health, well-being, whether directly or indirectly, kind of features in much of the things that we do. That's probably way over my time, but thank you so much for giving me the opportunity to talk to you. Diolch yn fawr iawn.
No, definitely, you're spot on. Thank you so much, David. That's the second time I've heard that, and it's still really engaging and fascinating. Thank you. We've got, well, I know I've got a question for you, but Zuara has put a question in the chat for you. So in the context of international health partnerships, there's been a growing emphasis on framing collaborations such as Wales partnerships with Africa as more mutually beneficial, as more mutually beneficial. Concepts like reverse innovation have emerged as part of this narrative. So Zoe's asked, could you share your thoughts on this shift in perspective, please? And there's two parts to it. And do you feel that the benefits to Wales are adequately highlighted in discussions?
I mean, it's a fantastic point, and I would probably say the benefits could probably be more highlighted, but we're well aware of them. We're doing lots of learning from Namibia at the moment in the context of health and nursing, for example. So this very much is a two-way process. The people that go out on the International Learning Opportunities Programme to Sub-Saharan Africa, yes, they're going there to get involved in projects in Sub-Saharan Africa, but the learning they bring back from experience has been incredibly important for developing and innovating here in Wales. So yes, I'm very clear, as is the Wales and Africa team. This isn't a case of missionaries going out to improve circumstances. This is a case of actually going out to forge some of those international partnerships and connections, and then coming back with that learning to improve outcomes here in Wales. So no, we're very clear on that process. Whether that's articulated in the most clearest way, I think that's a fair point and something that we're thinking about. But no, I'm absolutely 100% unequivocally clear in my own mind that we are getting lots of learning from some of our international development work.
Great, thank you. Thank you. I hope that answers your question, Zoe. I've also got a question, David, if you don't mind. You were talking about your renewing, your refreshing your international strategy at the moment. Are there any opportunities for us to get involved or feed in, or what kind of, how is that process panning out, and when do you plan to publish it? Yeah,
so there's two aspects to this. The first is that the strategy comes to a kind of natural end next spring, and clearly the world has moved on. Like I said, since we originally did that, I fully expect that what we will do is we will extend the current life of the strategy until the Senate election, so for another 18 months or so, and I fully expect ministers may probably prefer to go down that route, and so what we'll do is perhaps set out what the priorities will be over that period. I think then there's a separate piece of work then to evaluate the strategy as is, and then think about presenting options to a new government. I've spoke on and on about the Future Generations Act many times in that presentation, so I think hopefully you'll get a sense that genuine engagement and involvement will be part of it. That would have to be part of the strategy. That is the approach that we're committed to taking. So there will be opportunities to engage. I'm not sure whether it's still going on, but at the moment the Senedd Committee, the Culture, Welsh Language, Sport and International Relations Committee, I've got an open consultation on the international strategy where they're seeking views. That's going to be an incredibly helpful piece of work for all of us to see in terms of developing any new strategy. So you may wish to contribute to that, but if not, I'm very sure that there will be an opportunity to contribute into the strategy going forward. But I feel it's an incredibly exciting time for Wales on the international stage. I'd really welcome any contributions to that.
Fabulous. Thank you. Thank you very much. Yes. Whenever I speak about the Wellbeing of the Future Generations Act overseas, everybody's always really fascinated and engaged in it. So I agree with you there. So I've got one final question for you, and then we'll let you off the hook, David, if that's so Hardeep has said, very insightful presentation. Are there any opportunities for young people, university students, to join or gain experience from such programmes and get more involved in strategic planning with Welsh Government?
So yes, I'm sure there are. I'm always very happy to hear from people who want to reach out to me and have a discussion about our work or look to perhaps get involved in that. There are more kind of formal routes through things like the Tithe program that we have, which if people don't know is a learning opportunities program for people to do specific learning. Perhaps we can share a link on that. Very happy to do that. So there's that. And then the Welsh Government has particular schemes itself. For example, when I worked on that Beyond Recycling Circular Economy strategy, we brought in a number of students to come and help us do that particular work. So there are opportunities around particular pieces of work. So there is the informal, you can contact me, very happy to have a discussion with people around that. There is the more kind of formal TIFE programme, and then there is the particular initiatives that the Welsh Government have to bring students in to come and support us and work with us on particular opportunities. So there is opportunities to do that. Very happy, as I say, to give people more details about those kind of things if you want to get in touch. I'm also on LinkedIn. If people want to link to me on LinkedIn, you'll be able to see a lot of the things that we're doing and reach out to me that way too. So yes, a very long answer, but yes, informal and formal opportunities to engage with us, and we really welcome that.
Fabulous. Thank you. Diolch yn fawr iawn. Thank you very much. You know, now you've mentioned LinkedIn, you're going to be flooded with requests, don't you? You do. You do.
Very happy.
Anyway, so thank you very much. Thank you, everybody, for your questions. And we're now going to move on. And I am very, very pleased to welcome Meng Kaur. And Meng is the National Director for Screening and Health Protection Services at Public Health Wales. And Meng is also our lead contact for the International Association of National Public Health Institutes. Thank you very much for taking the time, Meng, to come and talk to us. And if you'd like to share your slides, I'm going to turn the floor over to you.
Diolch yn fawr iawn, Liz and bore da pawb. It's really good to be here. I'm just setting up my share screen at the moment and it's not appearing. I hope you can hear me. Let me just try again.
I can definitely hear you.
Wonderful. I think the screen should be coming up now.
Ah, yeah.
Brilliant.
Fabulous. Thank you, Meng.
Oh, thank you. So thank you for the opportunity to share, my experience of working as the focal point network for Public Health Wales's membership of IANFI. And Liz, thank you for spelling out the acronym. It saves me doing it. But it is, a membership organisation that helps us to really link in with other organizations, similar organizations across the globe. And I thought, I'd focus on how we strengthen co-production and learning through this network. And IANFI was developed, about 20 years ago now, and it's essentially a professional and independent network of the National Public Health Institutes. And the definition of that is academic, but essentially any institute performing at a national level and providing public health support and services is deemed to be, eligible for membership. So currently, I think there are over 110 members now in 95 countries, and it's organized through 4 regional networks. And I'll just show you a map of that later on. And essentially, the connection and the strengthening of the public health institutes across the world is part of its mission, and it does it by connecting institutes, whether it's bilateral connections or multiple connections through the various meetings and work programs. And the collaboration is often pump-primed or funded by quite significant funding streams, including the Melinda and Bill Gates Foundation. And essentially, it is to try to give a collective and individual voice for national public health institutes to the global community, and it also collaborates with other global entities like the World Health Organization. So just to state the mission, which is around collectively building public health capacity and capabilities through connecting, developing and strengthening national public health institutes across the world. And the strategic priorities, let me go back. The strategic priorities are pretty much reflected in the mission statement. So it's about strengthening of the professional relationships, harnessing the collective expertise of members, and then engaging, supporting and growing the diverse and unified membership base that we have. And I think one thing that it does very well is advocate globally at country level for how national public health institutes are key to the delivery of public health actions. And one of the overarching things is that we've got an agile association that supports its members through change, recognizing that the political, the global context changes on a daily basis. And we know what's going currently in terms of our global security. There are challenges for us, and we need to be agile to meet with those challenges. So this is a map of the IANFI members, and the different colors signify the different regions. There are 5 colors, but there are 4 regions. America is not part of a region, but it's got some oversight and strategic input into the work of IANFI. But essentially, there's a European network, which is the blue. There's an African network, which is the yellow. There's an Asia network, which is the purple. And then there's a South American network, which is green. And South America is very much dominated, I guess, by the work of Fiocruz, which is a large public health organization that serves Brazil. And I think it's got 17,000 staff. So it's quite dominant in terms of the work of South America, but it does bring together the other member organizations as well. And Public Health Wales is a member of the IANFI construct, and is most active in the European regional network. So we've got our own little arrow here for our membership. So this is to give you an example of the work we do with other global partners. So the WHO and IANFI signed up to an MOU to strengthen public health functions and health emergency preparedness, and actually agreed a revised list of essential public health functions. And there's a list of 13 functions that we now look to describe the roles of our institutes. And maybe some institutes won't deliver all 13 functions, but it is a comprehensive oversight of what those functions look like. And that MOU was signed in October 2022. There are 5 thematic committees in IANFI, and there's the one around climate change and public health, one around inequalities, essential public health functions, professional development, capacity building, and pandemic preparedness, response and resilience. And Public Health Wales is represented in 3 of the thematic committees, and I chair the pandemic preparedness thematic committee, which we only established recently a couple of months ago. And some of the work of the thematic committees clearly overlap with others. So I've asked for a bringing together of the chairs of the thematic committees to understand the complementarity of the work programs, but whether there are any gaps in our delivery as well. So around pandemic preparedness, one thing we're really keen is to build our understanding about behavioral science and how that impacts on pandemic response. So Jim McManus in Public Health Wales is actually leading that webinar because of his professional and personal interest. And we've got a webinar around ethics as well, because those were key issues for consideration during a pandemic that some nations might not have thought to prioritize, but have been very helpful in steering our way around the interventions that we put in place, particularly the social interventions that we put in place in pandemic response. Public Health Wales has also accepted a commission to undertake a secondary piece of research and undertaking interviews with key partners and stakeholders on looking at health promotion and how we apply health promotion approaches during pandemic response, really moving away from traditional health protection techniques, but how we actually apply those new ways of working in terms of the non-pharmaceutical interventions that we put in place. So we're building, our understanding on that. The Pandemic Preparedness Thematic Committee is also looking at how we assess our state of readiness for public health institutes for the next pandemic. It's not a tool that I'm aware of that currently exists, because most of the current tools are about assessing the country level state of readiness. But I think from a member organization and from a public health institute point of view, I want a tool that assesses whether we're ready as an organization to deliver our roles and responsibilities in a pandemic. The reason for mentioning that is that currently it's something that we're keen to develop in Public Health Wales, but through this global network, we're able to bring the learning back into Wales, which is one of the win-win situations about getting involved in global partnerships like this. And then regional networks, they meet regularly, and there's an annual meeting for each of the networks. And between those meetings, there are activities such as organizing webinars. We've taken part in 3 or 4 of the webinars in Europe in my time in the organization. And there are also work programs that look at specific topics. There is, however, an opportunity for us to join up the work of the regional networks and the thematic committees as well, because there is often an overlap in our focus. So again, we're organizing a meeting to bring together the chairs of the thematic committees and the chairs of the regional networks so that we can collaborate even better and more efficiently. And there's a focal point network. So I introduced myself as the IANFI focal point for Public Health Wales, and each of the National Public Health Institutes will also have 1 or more focal point members. And I recently stepped down from being the co-chair of the network, but the idea is that it is an operational arm for the work of the thematic committees and the IANFI executive board. And one of the things that we're doing currently is recently IANFI organized a survey of National Public Health Institutes looking at the 13 public health functions and asking what functions each of the institutes deliver. There's also information about staffing, about resources, capacity and capability. And we're establishing a task and finish group to analyze the results of the survey. I believe we've got about 70 responses, which is really incredibly helpful. And one of the things that we want to put in place is the ability for people and members to search the survey outputs and the search profiles for other public health institutes to identify whether there are any synergies or opportunities for collaboration, particularly around niche areas of expertise or countries of similar demographics who might want to learn from each other. We're establishing a mentorship program as well as part of that, so that we can buddy up with other organizations for specific topics or issues. And then lastly, I'm going to take the opportunity to kind of go live to the internet and show you some of the tools that are available on the website. And I've put the link in the chat there. So I'm just going to check with Liz and ask, do you see the web page on tools and resources on your screen?
I certainly do, yes. Thank you, May.
Brilliant, brilliant. Well, I won't take up too much more of your time because I know it's a really tight agenda, but this page, and I've put the link in the slides, which I'll share after this meeting, is really, really helpful in identifying what's available to member organizations. And this is actually in the public domain. So we have an open and transparent means of sharing this as well. So one of the key things is about how a nation who's interested in creating a national institute might go about creating and developing a national public health institute. And the guide is about how you form and grow the Public Health Institute. And it provides a common language for us to use about how we function so that we can communicate more effectively between us. And to supplement that, something that I was involved with a while ago, which is the stage development tool. I underwent some training as a facilitator, and this tool was really helpful because it uses a maturity matrix model to identify the level of maturity of a whole range of functions that a public health organization might deliver. So when you look at the discussion guides, if I click on that, you will see that there's a range of topics which are internally facing. So whether it's organizational leadership and management, or potentially externally facing, like the surveillance function, data to action, public health research, multi-sectorial collaboration. And if you click on one of these discussion guides, you have this matrix, which then helps you determine and assess whether currently you're functioning at a basic level on surveillance, and it cuts across 6 domains of focus, whether it's strategic direction, systems, resources, quality, engagement, and impact. And it also describes 4 other levels of maturity. And as a facilitator, I would go into a team, usually senior team, to look at the assessment of its current functioning. And for each of these domains, you would then define where you're currently at, and then you would identify what the gaps are, where your ambitions are. So in a year's time, you might want to function at an advanced level. You identify the gaps, and then you put in an action plan. It's really straightforward, but quite intense in engaging people in doing the work to describe, because each of these boxes, has nuances, but written in a really generalizable way, so it's not context specific. So that's a really good tool. And then other resources that are available relate to peer-to-peer evaluation. So an institute might pair up with another institute and have executive meetings to understand, how the organization might function better as a whole. And Public Health Wales paired up, I think, with RVIM in the Netherlands to undertake this peer-to-peer review a few years ago now. But that was really helpful in addressing some of the learning. So I've probably gone over my time, and I'm going to stop sharing my screen, but I hope that gives you a flavour of the current activity of IANFI and gives you an understanding of the potential opportunities that are open to us. And I'm very happy to be contacted offline or answer any questions from this meeting. Thanks, Liz.
Fabulous. Thank you so much, Meg. There's such a lot there. And I was listening to you, and I've heard you present on this before, Meg, and I kept thinking, how do you manage to do the day job on top of all of that as well? Because it sounds quite a lot. It's very in depth, isn't it? But I was fascinated by that maturity matrix at the end. And so is it a way of sort of enabling other worldwide national public health institutes to become more advanced in their thinking and their practice? Yes.
That's correct. It's such a powerful tool because it's so involving, and people, when they complete it, have ownership of it.
Fantastic. And so you have a role in a way, or we have a role as a public health agency and as an institute, and if we have the expertise in helping to advance that.
I'd be very happy to sharpen my facilitator tools and come and help, a team talk through one of these discussion guides. It's just a question of raising awareness of it and maybe identifying areas of application. I did want to do one around screening, but before I joined Public Health Wales, I worked with Andrew Jones, who I met when we were doing the facilitator training together in 2018. And I came along to the health protection team that I now currently manage to look at the surveillance function. So we've done that in Public Health Wales. And I think, we are yet to kind of apply some of that because the pandemic kind of broke some of that continuity.
Fabulous, thank you. And one reflection I had as you were talking, Meng, and then I'll let you go, is around the fact that you were talking about all the learning, the shared learning, the mutual benefits. But I loved what you said about the win-win of global partnerships. I think I might steal that one. Anyway, so thank you very much for coming. We didn't really have any kind of questions. We had one in the chat, but I'm not sure it's whether we can answer it or not. It's more about climate change and the African continent and the fight against climate change, but that feels a bit above my pay scale. To be honest with you, I don't know whether you have any reflections on it, Meng, and then I'll let you go.
Yeah, I know there's the African Regional Network, and I know they are starting to connect together and collaborate much better now that Africa CDC is established. And I think the first thing that Africa CDC, one of the first things they did was declare a continental emergency for Mpox. Colleagues will know that Mpox cases in Central and East Africa, particularly in the Democratic Republic of Congo, has increased, and it's spreading to other countries in Africa. Its international spread it's not as wide as we might have expected, but the role of Africa CDC is coming to bear, and I suspect they will also start focusing on climate change. So watch this space. But if there's anything that they're organizing, I think they've got 2 webinars over the next couple of months. But Laura is kind of on the distribution list and will send out the invites for these webinars, which are open to members and stakeholders.
Right. Thank you. Thank you so much, Meng. Diolch yn fawr iawn.
Diolch. Hwyl fawr.
And now on to our next section, and I'm very thrilled to welcome Chris Brown. She is the head of the WHO Europe Venice office on investment for health and development, and also Mariana Diakova, who you've met. Chris has a long history of working with us in Wales, and Wales have a memorandum of understanding with the WHO around health equity, wellbeing economies, which Chris and Mariana are going to talk about now, and also the directorate that I work within, and I've worked with Chris and Mariana over a number of years around investment for health and well-being, was designated by the Venice office, which Chris is head of. So I'm going to turn the floor to you now, Chris, and I look forward to hearing you and what you've got to say. Thank you.
Lovely. Thanks, Liz. First of all, before I just show the presentation, I just want to say I'm super delighted to be here today and to be presenting with Mariana a piece of work which we think is real innovation in knowledge and know-how leadership on how you actually put well-being at the centre of a government's development agenda. And I think Mariana and I are going to do a tag team today. I'm going to present the broader context of the work that we've been doing, and then Mariana will be presenting the deep dive that we've done together for Wales. So I'm just going to share my screen. Here you go. So basically the background to to this work we've done together is really this drive that GDP alone isn't measuring enough what progress is needed for today. It's not capturing all the things that are important to people in terms of living in safe communities, our ability to withstand shocks, whether it be climate, economic or health, as we saw in the pandemic, the ability to respond to and grasp new innovations, digital, social. And so basically the wellbeing economy movement comes from, as you might have heard it, beyond GDP. And just to say that this movement is being driven by local through circular economy, we've heard, through global, through the UN, as well as national. And I think what we'd like to share today is the learning around how wellbeing is being put into practice, how that knowledge leadership is inspiring further action locally and globally. But I wanted to just say that the drive for putting well-being at the centre of public and private investment, prioritisation and resource decisions doesn't just come from health. We have leading global economies driving this. Joseph Stiglitz, Nobel Prize winner. We have the head of IMF, Kristalina Georgieva. We have the head of WHO, Dr. Tedros, and the head of WHO Euro, Hans Kluge. We have OECD driving this. But importantly, we also have countries who are leading this, and Wales is a leading country. We have been capturing through a series of deep dives, which Mariana and I are going to do a tag team here to share with you the learning on how countries are really implementing well-being economies that's contributing to knowledge leadership. And I think that you'll see in the next few minutes what have been the success factors. What the aim of these deep dives into how countries are advancing well-being economies is basically to show how well-being economies can be implemented in practice, but how the health sector and the health system and public health are really a part of that. So health as a driver, for example, the way that health facilities are greened, procurement that is socially responsible, better employment practices, health as a partner, health workforce, for example. So in Wales, we know the Good Work, Good Health initiative is partnering with a whole range of different sectors and communities to address the well-being and employment and mental health of young people, and health as a beneficiary. So when we have decent employment and living wages, then our mental health improves. And so in 2023, we launched a European regional initiative on health in the wellbeing economy to ensure that health had a strong voice in those broader global economic change and development processes that I mentioned earlier. The purpose of these is a stocktake to capture the evidence that can then be used for policy exchange and dialogue, and to shape and inform policies in countries, to document what works, what has actually helped to shift from more traditional GDP-based economies to well-being at the heart of the economy, to support the countries who are leading on wellbeing economy, including Iceland, Finland, Wales and Scotland, to dialogue and share solutions to further advancing their wellbeing policies and budgets. Obviously to share learning exchange and to provide evidence for advocacy. I'd like to just pick up what's actually in the deep dives. Mariana is going to go much more into detail, but what we heard from policymakers on the ground in communities, as well as in national and local governments, was we need to know what are the political imperatives that are making countries shift. So things such as financial crises, the banking crisis in Iceland, in Scotland, concerns over poverty and insecurity, in all of the leader nations advancing wellbeing economies, this need to drive to shift to more thriving societies, to future-proof the society against shocks, whether they be climate, economic or health, but able to be more able to respond positively to technological and social changes in a way that enables all people to benefit from those, and therefore to close health inequalities and to ensure more prosperous lives for all. Deep dives go into the kind of hard and soft governance mechanisms such as laws and acts, as well as the more participatory and mechanisms used. And in Wales, we're super proud to report about the Wales We Want dialogue, a whole dialogue with people in all communities in Wales about the society they want, and then also governance mechanisms linked to budgeting and financing strategies. We know that the deep dives are telling us that we can't actually go beyond a concept unless we have the metrics. So in all of the countries, metrics, indicators that include both the traditional economic indicators, but indicators around social inclusion, trust, sense of well-being, environmental sustainability are all used in a national indicators framework. And the smart thing is these are linked to decision-making instruments and structures, whether they be budgets or resource prioritization or policy development. And obviously within that, public health has a huge role to play. I outlined just before some of the ways that public health in terms of its policies and services are doing that, but we also know that public health strategies and plans in each of the countries, and in Wales particularly, are aligning themselves more to well-being and linking health, the economy, society and the environmental aspects of well-being. And we're also seeing how public health is an innovator in advancing well-being at the centre of the economy and decision-making. For example, the Wealth Health Equity Status Report, the Welsh Public Health Social Return on Investment Simulator, active transport policies. These are all ways that, particularly for Wales, but we see in all our other leader nations, that public health is actually being a driver. Wales also has one additional, what we feel is really important mechanism, and that's the Future Generations Commissioner. And you also have a European Wellbeing Economy Champion in your First Minister, Ellen Morgan. I'm not going to dwell too much on these, but what did we learn from the deep dives into how Wales, Scotland, Finland and Iceland have really moved on in the last 10 years to put wellbeing at the heart of economic and social and public policy? One, high-level commitment. You need the political commitment. In many countries, you have a prime minister, a first minister who are the champions for it. Also, being able to leverage for national action the support of international agencies. So we've heard a little bit more earlier from the two previous speakers about how that international environment is supporting Wales, and Wales is supporting the international environment. But we in WHO have been working really closely with Wales, because we have a special relationship and MOU with them, to ensure that global learning can be imported into Wales, and that Wales learning can be taken for global advocacy and inspiration in other countries. I've also mentioned earlier that we need legislative, politically binding commitments. So the Future Generations Act in Wales, the Fiscal Board in Iceland, are all ways that any decisions that affect the well-being of the nation is due to be reviewed by a well-being lens. We said about public health and the public health sector having a key role. These are some of the main ways, and Mariana's going to explain more about it in a minute. 4 key roles. as advocate and change agent, as a convener and a facilitator of cross-government dialogue, contribute to shaping policies that impact well-being, and to adapt our kind of welfare systems for the 21st century, recognising the greater complexities and demand. And in this way, we're able in these reports to show that well-being goals of government cannot be achieved without a strong public health role. And my final point really before handing over to Mariana is just to say that the report that we have done jointly with Public Health Wales and that Mariana will be talking about, and I guess it's formally launched, is that this is a critical know-how and leadership tool. It is already being used to inspire and support impact internationally. Let me give you some examples here. There will be a Leaders Nation policy dialogue hosted by Wales in Cardiff in March that will bring together not only Iceland, Finland, Scotland and Wales, but observer countries, including Moldova, who want to put their country on the right track to ensure well-being and sustainable development. The work has already been workshopped and shared and has inspired the WHO Pan-European Wellbeing Economy Initiative and is actually reflected in the new 5-year strategy for WHO for all 53 member states of the WHO European region. The report has also been a resource that has supported global dialogue and commitments. For example, at the World Forum on Wellbeing last week in Rome, the part of the work was presented to inspire countries such as the Czech Republic, the USA, Japan, Thailand, Argentina, about how they can themselves adapt and move forward to put wellbeing at the centre of the economy. The work has also been used as a reference for a global resolution of WHO. So in June this year, 192 member states adopted the global resolution on the economics of health for all, and the work of Wales has been referenced within that as one of the inspirations for how this can be achieved in practice. We talk about global and European, but really well-being is about people's lives where they live, and already the report is having an impact at the city level and is inspiring whole place innovation sites that want to adopt a whole wellbeing approach in Italy, in the Netherlands, Spain, Norway, USA, Serbia and Moldova. So I'm really delighted and very proud of the work that we're doing together, and would like to commend Wales for its leading role in advancing an economy of wellbeing. Thank you.
Thanks a lot, Chris. I don't know, Liz, whether you're going to pick up or do you want me to pick up?
No, I was just going to say amazing. Thank you so much, Chris. Mille grazie, rather than diolch yn fawr iawn in your case, seeing as you're in Italy. And if you've got any questions for Chris or Mariana when she presents, please put them in the chat. And I'm going to hand over to Mariana and you can describe the deep dive that Chris has just outlined. Thank you.
Thanks a lot, Liz and Chris. Grateful for your recognition and really pleased that we've been working together for, what is it, more than 10 years now, probably, and enabling and driving the work in Wales. So I'll share my screen. My presentation is quite short, just giving you a flavour of the deep dive. And Chris mentioned some of the key points anyway, but I'm just focusing. Let me just fully be able to. If you can confirm, Liz, that
yeah, just need to put it in slideshow, Mariana, and then
trying to
from the beginning. On the far left, Mariana, from the beginning.
Yes, I'm doing it.
You can see it.
I don't know why it's not doing it.
Oh.
Sorry.
It's okay.
There you
go. Yes, good to go. Great, thank you.
Perfect, great. So Chris provided a really good background and context of all of the 4 deep dives WHO is developing, and Wales' leading role as part of that. Just to say, unfortunately, the key lead on developing the deep dive for Wales, Anna Stilke, who is a senior officer at the WHO Collaborating Centre, is unwell today, so she couldn't join us and presented herself. And credit to her and Gabriele Pastorino, both of them are really leading on this work as part of both Wales and WHO. So as Chris mentioned, the deep dive, we launched it on Monday. At the first inaugural Wellbeing Economy Festival of Ideas, co-organised by the Future Generations Commission of Wales, Wellbeing Economy Cymru for the region, and then Public Health Wales, a few other co-organisers. So we have managed to do this in person. A really great interest from across sectors, the public sector, the third sector, private sector gathered there, and we also had a session on health in the well-being economy. So this was really good to see all the interest and commitment from across Wales to this agenda. Just to reiterate what Chris has mentioned specifically about Wales, we are currently one of the few leading nations in this space, and a live innovation site for the well-being economy, specifically in relation to health and public health, with our Wellbeing of Future Generations Act. As well as we do have a memorandum of understanding signed in 2020 and renewed in 2023 between the WHO Regional Office for Europe and Welsh Government, and our current First Minister, Eluned Morgan, was appointed as a WHO champion for the Wellbeing Economy Initiative when she was still a cabinet secretary for health and social care, and now she's the First Minister, so we are even more hopeful that this agenda will be driven more strongly going forward. Just a bit of a summary around the key policy messages, specifically from the Wales deep dive, the drivers of the shift in Wales. Of course, is the legally binding whole of government and public sector commitment delivered by the Wellbeing of Future Generations Act, as well as a portfolio of legislation linked to that, for example, the socio-economic duty, which focuses on equity, our economic strategy in Wales, as well as a Healthy Wales Foundational Economy Programme. Very importantly, a future-focused approach, looking into how we can make sure our future generations are having a prosperous and more equal and a healthier Wales to and a more resilient Wales to live in. So this is one of the key, of course, ways which the Wellbeing of Future Generations Act is innovative, balancing the needs of present and future generations. There is also a very strong focus on culture and the Welsh language, which is our 4th pillar, as we have the 3 pillars of socio-economic and environmental sustainable development, but we have also in Wales our 4th pillar, which is culture and the Welsh language. As Chris mentioned as well, accountability, very important. We have a framework, an indicators framework attached to the Wellbeing of Future Generations, as well as our public health outcomes framework and other measures which are applied to make sure public bodies are accountable and also success is measured. The Act has been developed through a participatory engagement processes, and we're trying to continue this. There was really a very strong voice on Monday from individuals, from third sector organizations around how do we continue these national conversations, which was started as part of the Wellbeing of Future Generations and informed the Wellbeing of Future Generations Act. And how do we continue this? And I know Chris mentioned also the Future Generations Commissioner. They have also they're doing a lot of work around learning and talking to communities and people across Wales. And we also have in Public Health Wales the Time to Talk Public Health National Survey. So we're trying really to bring this public voice and empower our people and communities and different population groups to be co-designers and co-create this new economic system which benefits people and planet going forward. And Chris also mentioned the role of health or public health, so the health sector as well as population health. And of course, public health is the science and art of improving, promoting and protecting population health. So from this perspective, we are really at the forefront, working with partners across other sectors as well as showcasing is a huge amount of evidence already behind the enabler and driver's role of population health and of public health through investing in prevention, through shifting budgets to prevention and focusing resources into preventative interventions which are keeping our people healthy and well, as well as a focus on health equity, which is really important. So this is what we have been working with the Venice office and WHO around really bringing health and health equity as central to the well-being economy new paradigm and international collaboration, which we are all here about that. Of course, there are challenges, and although we are leading and being recognized with the legislation, policies, sort of across government approaches, there are lots of challenges into really implementing this into real life and practice. So we have a lot to do, and learning also from others. There is pockets of good practice across the whole of Wales, as well as the UK internationally. So this is one of our aims going forward, of how we bring this together and accelerate progress, accelerate mutual learning, cross-fertilization to maximize value and impact for our population as well as for others across the European region and globally. Balancing the short-term results and planning and structures and processes with the long-term thinking. This is coming across quite strongly, applying different types of metrics and specifically measuring and modeling around well-being, bridging the rural-urban gap. There are other priorities around and challenges around mental health, youth mental health and well-being and social inclusion, healthy and active aging, and so on. So all of these areas we are looking together with the Venice office, who is leading in this area across the WHO European region and beyond that, and together with our Welsh government and partners to be looking into how we can develop tools and solutions to be dealing and tackling these challenges, as well as implementing our Wellbeing of Future Generations Act. So this is a summary. I'm not going to go through again. So again, it's highlighted, and hopefully you will be reading the deep dive. I'll drop the link in the chat, and learning more about what Wales is doing in terms of the public bodies and cross-sectoral commitment, as well as what is happening internationally in this space. Just to mention again, Public Health Wales is uniquely positioned. We are implementer into the WHO Welsh Government Memorandum of Understanding, looking into health equity. We've developed a solutions platform. We have developed a program of work around investing in prevention and social value economics and modeling, developing public health informed wellbeing economy approaches and tools, and supporting the wider WHO Wellbeing Economy Initiative. So I'll stop it here because I think we are ahead in time, and now everybody probably needs a break. And then we will be having later a discussion. Hopefully, whoever decides to stay a bit later, we can have a little bit of a discussion of the different views of how public health and the wellbeing economy can be our co-beneficiaries and be working together better.
Fantastic. Thank you. Thank you, Mariana. Thank you, Chris. Amazing work. And it's really interesting to me about how Wales is always held up as an innovator, and how the WHO and Venice office and yourself, Chris, have been very vocal in advocating for our work as well, and for the work of Wales and the Future Generations Act and everything that mobilises for the wellbeing economy and health equity status previously. We don't have any questions as in the chat, but I do have one for you both, if you don't mind. And it's around, Chris, you talked about how you'd presented the work at Rome and at the UN, and the resolution was adopted. So obviously you've had a great reception from some nations. Have you had resistance or any challenges back from others, particularly those who are still focused on GDP and economic development, that might be to the detriment of health and well-being, for example?
So I don't think it's specific countries, but thanks for the question, Liz. I think we need to recognise that there's lots of mechanisms in place that prevent many countries who might be interested from shifting. So, when you have GDP, when you have your national account, when you have the main basis by which countries globally are assessed in terms of their economic progress and standing in the world, and that is very much based on GDP, then, and because it's a simple one single indicator, it's very difficult. I think what we find, if I'm really honest, Liz, is that there's movements in many countries at different levels, some at the local, some at the national, some in professional organisation. In some cases, it's being driven by the not-for-profit business sector. In other cases, it's coming through for EU countries and accession countries, it's coming through the kind of commitments at the EU level where there's a binding commitment to respond. So what we actually see is that there's movement in almost every country. The issue is that I would say two things of learning. One is that going from small scale to whole country is the big challenge, and that is why we're doing the deep dives. That's why we're having the collaboration. That's why we're doing this partnering between countries that are doing it, and countries who would like to, and also countries who are maybe skeptical, where in the room and they're hearing about it, find always, oh, actually that's super interesting. So I mean, if you're a politician, if you would say to people, look, we want to have an economic policy that's probably going to leave some of you out, struggling to get by every day, it's not a winning strategy. So there's nothing about a well-being economy that a politician can't sell. The word gets in the way, a well-being economy. What we are using is value-based spending, policy, partnerships and services, and that we are saying value is, yes, economic value, GDP, but it's value in terms of these other indicators such as human safety, where people live, the ability to thrive and to participate in social and cultural activities, protecting the environment. So these are all the values, and the smart thing that Wales has done with the other leader nations is they developed these indicators and embedded them in decision making, and they are then the envy of many countries, and this is where countries are looking to. So this is why for us it's easier for me to introduce a policymaker and a politician in Wales to a policymaker and a politician in another country than it is. So this is what I would say is why the partnership is working so well right now. I hope that partly answers your question.
It does. So you're like a broker in a way.
Correct.
Yeah.
Correct.
Yeah.
Correct.
Fantastic. Thank you. So thank you very much, both of you. And thanks for putting the reports and the links in the chat for us. That's wonderful. And yeah, I hope to see you again soon. So diolch yn fawr iawn and mille grazie. So, and with that, we will proceed with the programme. We were due to have a quick short break, but we've now got our next speaker. So, you know, many of you have got your cameras off, and so you can get up and have a stretch and also have a listen. So I'd like to welcome now Giri Shankar. Yeah, Giri's here. Lovely. Thank you. Nice to see you, Giri. And thank you very much for agreeing to present. And Giri is the Director of Health Protection in Public Health Wales. And he is also the co-chair of the Faculty of Public Health's Special Interests Group, India. And you're going to talk to us about your work there, Giri, which I know is amazing. So you don't have any slides?
No, I don't. I mean, I can show some slides if colleagues want, but I thought I'd keep it more verbal. I don't want it to be
works with me, Giri. Yeah. Over to you. Thank you.
Yeah. Prananda, thanks a lot, Liz Dioc. I'm actually in a conference venue, so I'm sort of taken over some space in somebody else's room. So I'll try and keep my voice quiet, but can you hear me okay?
Yes, absolutely.
Okay, lovely. Thanks. Thank you for the opportunity to share my thoughts here. I know you were due to have a break, so I won't keep it long, as I do need to leave in 10 minutes. So I'll keep it really short. But for those who are interested to join the work of the India SIG group, you're most welcome to contact me offline after the call, and I'd be very happy to discuss further. So for us, I took over as the chair of the co-chair of the India SIG group. So these, for those colleagues who are not aware of what SIGs are, they are special interest groups. These are groups set up by the Faculty of Public Health membership on various aspects. They could be SIGs relating to a particular country or a geographical area, or they could be SIGs in relation to a particular topic area, climate change, disaster risk reduction, mental health, etc. So there are a lot of these SIGs. At last count, I think Faculty of Public Health had something like 35 such special interest groups. This SIG that I'm involved with is called India and Related Countries SIG, and it just covers the related countries bit cover the immediate neighborhood of the Indian subcontinent. That includes Sri Lanka, Bangladesh, Bhutan, etc. Pakistan have their own SIG, and therefore that's not part of this group. So this SIG has been in existence for a number of years, previously chaired by a public health colleague from the northeast of England called Sushma Aquila, who was the chair of this group for a long period of time. Considerable work had gone on about this through funding received from DFID in those years. But as the funding dried up, the activity of the SIG sort of got reduced, and on paper there are 55 members of this group, but particularly since the pandemic, the activity had almost ground to a halt. Back in 2023, myself and Hema Shukla, one of the other consultants in Blackwell, agreed to take on the co-chair of this SIG, and we wanted to revive this. So essentially, then we've met a number of colleagues across the Faculty of Public Health and also key contacts that we have in India, and developed a 3-year work plan for the SIG. So essentially, we have got 5 key objectives for us over the next 3 to 5 years. One is to absolutely resurrect the membership of the SIG, both through formal and informal channels, because a lot of colleagues are interested but don't know exactly how they can contribute. And the second one is to establish a handful of, by that I mean between 3 and 5 trusted partnerships with national and subnational health organizations in India. These could be statutory agencies, academic departments, etc., with an aim to make an impact on public health in India. And the third objective is to explore interest in other neighboring countries such as Nepal, Bhutan, Sri Lanka, Bangladesh, and make the network slightly bigger. The fourth objective then is to facilitate a couple of joint workshops, conferences on topics of mutual interest between colleagues in India and here in the UK. And then the final one is to share learning from other country SIGs. So with that aim, we restarted that, and we have now made some progress. So some of the things that we have now progressed is back in February this year, the Indian Association of Preventive and Social Medicine, which is one of the largest public health organizations, a professional grouping in India, invited me to talk to them about disease surveillance in the post-pandemic field, which I was able to. And as a follow-up of that, they reached out to say whether they could do a memorandum of understanding between that organization and Public Health Wales. Although I'm presenting this as a work of India and related countries SIG, it's pretty much embedded in the work that we do in Public Health Wales, and much of what you would have already heard this morning in terms of the international strategy of Public Health Wales and how various colleagues are contributing to that. So it's essentially collaborative partnership working across the three organizations. So we now have a draft MOU that has been signed off by partners in India. It is awaiting sign off by the business executive team within Public Health Wales, and I'm confident that we can move on that quickly. Once the MOU takes effect, we have a number of ambitions for the partnership to develop. We want to start slow and keep it sustainable rather than try and do everything in one go. The first of which will be to look at organizing joint webinars and seminars. So for example, there are so many public health topics which are mutually relevant to the two countries, climate change being one good example. We are developing indicators for climate surveillance, as are colleagues in that country. But I think the methodology wise, in terms of harmonization, it would be really useful to have that. And so we'll be starting with that. Then we have some massive potential, but a massive issue as well with regard to antimicrobial resistance. The surveillance for antimicrobial usage in India is still in its very infancy, and a lot of antibiotic usage happens in the human health sector in a completely disorganized manner, with prescriptions not being adhered to, and also over-the-counter sales of these antibiotics. So we do have a national action plan, as some of you be aware of, in the UK, and Wales, we have our own national action plan. It would be good to collaborate there and develop and strengthen the antimicrobial resistance surveillance. This is particularly important because of the amount of travel that happens between these two countries. Even within Wales, up to 20,000 individuals who are of Indian origin have Wales as their home, have family and connections there, with at least one annual visit either side, perhaps more there. Therefore, the number of travel just with Wales is high, and including, if you include UK, that's even higher. So people also have a tendency to seek healthcare when they fall ill there, and some of that includes hospitalizations. Therefore, these topics of antimicrobial resistance becomes really important. Later on, we have plans for staff exchanges, technology transfer, etc., around some of the areas where we are leading on. I can see Tom Connor is on the call. Some of the work Tom and colleagues do on genomics is quite world leading, and there are absolute opportunities for us to promote those and collaborate with those. So these are all intended future activities, but we are laying the foundations now for developing that partnership through the MOU. Then through my personal contacts also, there is some activity that has going on. For example, in the southern Indian state of Kerala, they are developing a statewide Center for Disease Control, similar to CDC in the US, but more limited to the geography of that state. And we are being asked to be their technical partner for a number of things around pandemic preparedness, disease surveillance, field epidemiology, etc., which again, I'm also in the process of developing. So at this stage, I don't have any concrete outputs to share, but it's about ideas and where the future of the collaboration lies. And I thought it would be useful to share this. So that's probably all I have now. But if anybody is interested to be part of this SIG, I think you have to be a member of the Faculty of Public Health first to become a member of the SIG. But that does not restrict any other colleagues wanting to be part of this collaboration, because we can always use this forum, the PHW International Public Health Forum, also to discuss ideas. And I have no doubt that number of our colleagues have a lot of skill and experience that they contribute to the objectives of this SIG. I'll probably stop there, Liz, and happy if I can stay for under 5 minutes if it's okay to take any quick questions.
Thank you. Thank you very much, Giri. That was really, really interesting. Particularly what you say about the travel back into and the over-the-counter antibiotics. It's amazing what you learn in these fora, isn't it? It really is.
I mean, it's fascinating, you know, in some parts of the country there, you would actually, this is no exaggeration, this is fact. A 14-year-old kid could be selling ciprofloxacin to you over the counter, who would be employed in such medical stores there.
Wow, and ciprofloxacin is really strong.
Yeah, well, just as an example, you could get almost any antibiotic that you want without a prescription.
Wow. Wow, no wonder you need to tackle it. And also what you said about climate change, because I know you and I have both worked with Manipal University and presented on their lecture series on health and climate change too. Have a question from Amber. Is the scope of the MOU broad to include emerging threats and other areas of interest?
It is indeed. Yes, thanks, Amber. Yes, so what I have done is I've drafted the MOU to include largely health protection issues, because that's what we are focusing on. And we want to see this as a proof of concept and see whether the partnership works for both parties. And therefore, I've intentionally kept it as one year rolling contract. And if we get positive engagement and we are able to demonstrate added value through these partnerships, of course, in future days, we can expand it to wider areas of public health interest. I know, speaking to my colleague Graham Brown in screening, they are very much interested in collaborating, because developing population level screening programs is something that is very unstructured in India at the moment. And there's a lot we can offer in that space. I'm also very mindful that it's not a one-way street. It's not us going in with saying we can help in ABC, but it's also about what we can learn. So, for example, when the COVID vaccination drive was happened, it was a massive logistical challenge in India, but they absolutely successfully overcome that with use of digital tools and technology. On one day, sometime during the peak of COVID, on a single day, they delivered 20 million doses into the arms of people. And even for any country, it's a massive, massive challenge, but they did it absolutely smoothly, like clockwork. So there are so much we can learn from such actions as well. And I'm very conscious that we need to make it two-way.
Fantastic. Thank you. I hope that answers your question, Amber. And she said very, very interesting. Thanks, Giri. Would be interested to hear more about
of course.
this. So
Yes.
yeah, lovely. Thank you. So does anybody else have any more questions for Giri? Otherwise, I know I can see you're at the conference. We'll let you get back to it. I know
Yeah.
it's tricky finding space. I was at
Yeah.
one last week and there was no space
No.
whatsoever.
No, I'm very grateful to colleagues here who have let me use this room for a short period.
Yeah, okay. And yeah, you've had a number of thank yous and how interesting it is. So Maria, thank you, Maria, for your comment as well. So I'll let you go and then we'll move on to the programme. Thank you.
Yeah.
Diolch yn fawr iawn, Giri.
Thanks, everybody. Have a good rest of the session. Bye now.
Thank you. Right, so that's the end of our presentations and our speakers. So now we want to discuss a few things with you, and also this is the first in a series, and we'd like to know if you'd like to share your work, what would be helpful, whether this kind of session and format is something you'd like, or whether we could turn it into half training, half discussions or fora. So my partner in crime in the IHCC, and my very valued colleague Laura Holt, who's the global health, the senior global health officer, is going to facilitate the discussion till the end of the session in about 20 minutes. And I know Mariana's also got a few things she'd like to discuss too. So Laura, over to you.
Thanks, Liz. And yeah, you took the words right out of my mouth. So this is our first forum. So thank you so much, everybody, for coming. So we're very aware that everyone's kind of been talking at you at the forum. So we were really hoping now that everybody would get a chance to have a discussion. So I don't know if we can enable everybody's microphones and cameras, or perhaps just microphones. Jamie, if you could help with that, that'll be great. I know that Mariana has more to discuss about the wellbeing economy, but I would also like to put it to the group if anybody has any international activity that they would like to share with the group, or any important topics that we haven't covered and you think would be really key for our next forum. Yes, I'm really interested in hearing from everybody else if people are keen to share. I think everybody's fallen asleep.
No, they're just shy, Laura. They're just shy. If you'd like to speak, please, just put your hand up or put something in the chat. That would be great.
Definitely. And like we said, we want this to be everybody's forum, and we want it to grow it, and we really want everybody to be involved. So any sort of feedback that you can give us would be great. And also on another note, because we can't access everybody's contact details because of GDPR, if you'd like to join our mail list and receive our newsletter, or if you want to talk to us about something else, providing us with a case study of a topic, for example, then please get in touch with me directly and I can add you to that. So I'll just pop my email in the chat for you.
Mm-hmm. Andrew, how do you join the India SIG? I think we'd need to ask Giri that.
I can answer that. No, I can answer that.
Marvelous. Go on then.
Sorry, I'm the CPD for the advisor for the faculty, so I'll just throw that in there. If you go onto the faculty website and you sign into the members portal, there is a list down the side where you can join SIGs. And if you go and find the India SIG, you can join it that way, and it sends an email to either the chair, who then puts you in touch to make sure you link up, and you can join any SIG via that method. So it's on the members portal of the faculty website.
Thank you.
Great, thank you.
You're much more sophisticated than me. I'm already signed up and I'm just staying with the ones I've got.
Yeah, if you know the chair and you email the chair directly, that will help too. But this does allow every single SIG is available. It also is where you can book onto events run by the faculty. So webinars, seminars, etc. is done through the same portal. So it is on there, and that's the way you book.
Great. Thank you, Megan. Thank you.
Wow.
So Mariana's put some questions in the chat for us, but you do have time to present your slides and load them up and ask the questions, Mariana. That's not a problem at all.
It's okay, Liz. It's only one slide with the 4 questions really, which are linking public health with the well-being economy.
That's so, fine. We've got 10, 15 minutes. That's no problem at all.
We had a really good discussion at the Wellbeing Economy Festival of Ideas on Monday, having colleagues, so directors of finance, colleagues from Welsh Government, also Active Wales, third sector organisations. So it will be really interesting to hear how colleagues across the public health community really are thinking about, and if they're thinking at all of the contribution of public health, of what we do as a community, a public health community, to promote, to implement the wellbeing economy approach in Wales in relation to our Wellbeing and Future Generations Act, but also the foundational economy. We know the NHS is getting around, well, more than 50% of the Welsh Government budget, and it's the largest employer and procurer in Wales. So there is an important role for health boards and trusts to play as, for example, we call it anchor institutions in their anchors in the local communities, including employing, local procurement, local employment, supporting local businesses, and all of that. So it'll be really interesting to hear from colleagues across the country or whoever else has joined, to see if they have, if they're already maybe doing something in relation to that, their experience or the challenges they're experiencing maybe into this. So yeah, it'll be really good to hear. As Laura was saying, we've been talking now for an hour and a half, so it'll be good to hear from others as well.
Thank you, Mariana. I think everybody's gone shy, to be honest.
Well, it has been a long session. Maybe we can have a... Oh, there's somebody online.
Hi, Maria.
May I ask a question? And it's
of
very
course
basic.
You can. Nice
very
to
basic.
see you.
Hi, Liz. Lovely to see you. And the network, I have been watching. I've been a bit of a lurker because up until recently, my job and also professional society commitments have meant I've not been able to come to one of these. And now I'm retired, but I'm not retired. So I've just got a little 2-day-a-week job working freelance for a charity that invests in oral health improvement research, but also initiatives, and they work they align very strongly with WHO. And I was just wondering, because I've worked in public health for more years than I care to remember in dental public health, but I'd never really heard about the international much detail about it, other than I knew it existed. I didn't know we had a Wales Africa programme. And my question, and I'm really sorry, it's such a naive question, really, is: do we have oral health representation on any of the initiatives that you've been kindly presenting today? Because oral health, you can't cut the head off from the rest of the body. Being able to eat, dignity in a later life, being able to function, being able to speak, some of the diseases related to cleft lip and palate, and then communicable diseases and non-communicable diseases. Do you have any oral health colleagues on this? I noticed I didn't see any familiar names from dental public health or Welsh Government.
It's not for wanting to try and engage, Maria.
Right.
So
okay.
It's often if people are interested, they will come, or if they have time and capacity, they will come, and from a variety of organisations and health boards across the NHS or third sector organisations. So I hear what you're saying about you're retired. You're too young
Yeah.
to retire, Maria.
Well, it's all the
But,
creams I use.
you
Go
know,
on.
you're welcome to join we have quarterly meetings, or you're welcome to present your work at the next forum, for example. So, you know, to explain the importance and also, you know, so how the international connections as well. So.
Yeah, I mean, I've literally just started. The organisation is known as the Borrow Foundation, and they first, the originator was a farmer, and he put money into dairy farmer. He put money into milk fluoridation in projects mainly in Peru. But of milk fluoridation, the evidence became a bit grey and not as effective, and they moved generally into oral health improvement initiatives, but also helping countries to set up oral health policy. So some countries overseas, and I was very interested with the International Group of Public Health organisations, and I'm hoping when I go back to speak to Nigel Borrow, the son, and the lady who I'm working with, sort of job sharing the role, to find out if they're aware of that group, because they haven't mentioned it to me. They definitely are aligned to WHO, because that sort of infrastructural knowledge linking to oral health policy and wider public health and NCD policy. It's been a fascinating morning for me, because as you know, Liz, my work focused mainly on Wales and the UK, and my eyes are being opened up to a whole new sphere, really. So yeah.
Literally a whole new world, Maria.
Yeah, exactly. But, you know, so I thought I'd mention teeth because they get forgotten. They're a bit of a Cinderella area. People think it's not a matter of life and death until you start digging a bit deeper, and then you realise, yeah. Okay.
It's really important, Maria. And if I can add, do you know we have a dental public health consultant who is leading this area in Public Health Wales?
Oh yeah, I know Anup Karki. He leads dental public health. Yeah. But I just wondered if he'd been involved in discussions pertaining to what was, you know, been presented this morning.
No.
We haven't really, but having said that, that's a really good thing, because this is what happens when you sort of link colleagues across the system. So you can be maybe the driver agent. I know Anup well, and he has been part previously of some of our meetings, to be fair. And I don't know. Yeah, he might be doing work across you know, across borders as well. Also, internationally, from a WHO perspective, I mean, they would have, of course, a focus on that necessarily. In some ways, because there is a huge focus on and priorities the health workforce, but there's been the recognition more recently that when you say health workforce, it's always about doctors and nurses. So there is a wider raft of health professionals which needs to be considered, you know, dentists, pharmacists, but also allied health professionals who are actually essential, specifically in these preventative, you know, services and interventions. And this is where oral health, I think, comes, because it's very much, you know, as you say, is people don't necessarily consider it as important, but it's a really key area in terms of prevention. Yeah, so I mean, you're welcome to follow up, of course, with colleagues, and we can see how we can maybe promote this area in one of the next meetings. The NHS as well, maybe because there is also the IHSE has the NHS International Health Activity Group. So this is with colleagues, focal points across all health boards and trusts. I think this will be really relevant there, and linking with others across the NHS who are doing this.
Yeah, thank you. I wasn't trying to be negative about my colleagues in Wales, because I think oral health and dental care at the moment is a priority at home, as you can appreciate. But it's just, you know, perhaps going forwards, because I don't know what the Borrow Foundation, but they're obviously wanting to make links to address oral health across the whole of the world. And I mentioned about the fact that Wales had some international, and they were keen to learn about it. So I'm hoping I can share the link of the meeting today, you know, as the recording with my colleagues. But thank you very much. And I'm sorry if I've hogged the question space, but it's been
no, not at all. This is a space for anybody and everybody. So I welcome your question. Thank you so much. Has
Thank you.
anybody else got any questions or anything? No? Mariana, I'm sorry, we haven't had much feedback for your questions.
It's okay. It's quite, yeah, it may be a little bit maybe complex or maybe further away from people's day-to-day work, but I mean, I suppose we feel it's really important to sort of engage into this long-term thinking and thinking how public health is part of this wider context in terms of environment, economy, and what is our social capital, what is our contribution. We're obviously beneficiary. We benefit from a well-being economy through the wider social determinants of health, but we also contribute. So there's quite a bit of evidence, again, in one of the links we have developed as a collaborating center around economic and social footprint or input of the NHS to the wider economy, evidence around the social value, which Chris was mentioning, or the public value, well-being impacts is being called in Wales. So yeah, I think it's quite important that we also consider everything we're doing is having a wider impact on the sort of a wider system, and which on its then has an impact on population health and well-being. So I suppose this is the main thing, and of course the learning and the expertise of international learning and expertise. And I am really pleased with Zoe's question around this mutual learning, because it's considered sometimes that we maybe only we provide the sort of best practice and leadership, but on the other hand, we have a lot to learn and a lot to do to be actually implementing this in practice. And this is the policy implementation gap is the thing which we will need to address in Wales, and we don't have to address it on our own. So lots of other countries and regions are struggling with that. So there is quite a bit of and synergy and a cross-fertilization we can do, and that's the point also of these sessions. So really huge thanks, Liz and Laura and the networks for organizing this, and I hope it has been useful, although and engaging, and people just maybe thinking, and colleagues further on some of these questions, and then we can pick up other topics with whatever the interest is. Maybe we can have a call of interest, Laura, around our network and see what would be the topics which colleagues would like to hear, with obviously with the international collaboration and partnership.
Fabulous. Thank you, Mariana. Well, you couldn't have put it better myself. So you've done my job there in terms of summing it up. So thank you very much, Mariana and Laura. So if you want to provide any case studies, present or discuss anything at our next session, which will be next year, then please, Laura's put her email address in the chat. Please drop us a line. The other thing is we have got an evaluation form, and a link is there in the chat as well. So if you could complete that for us, we would be very grateful. So Laura, anything I've forgotten? No, in that case, thank you very much, everybody, and have a good rest of day, and I hope to see you all soon. And thank you very much to all our speakers and to co-presenters. Thank you. Take care. Bye-bye.